Hi, I'm Michelle Tester-Jones and I'm an environmental psychologist and a lecturer in public health at the University of Exeter. Whilst we know that nature is good for reducing the risk of mental health problems, I'm particularly interested in exploring the benefits of nature for those already experiencing symptoms. As part of the recently completed Blue Health project, I used an 18-country cross-sectional dataset to explore questions around motivation, use and experiences of blue space in those with common mental health disorders, such as depression and anxiety. And the study produced some interesting findings demonstrating that visiting natural spaces is beneficial for those with depression and anxiety, but that the source of the motivation to visit nature is really important, because if it comes in the form of pressure from others, there's potential to undermine those benefits. But I think these findings need extending to also better understand questions around usage and impact of accessing nature for managing symptoms in the context of urban green and blue infrastructure. Specifically, I think it's important to explore reasons why people experiencing depression and anxiety want to access urban green and blue infrastructure, so their motivations, as well as what impacts their usage and ultimately how beneficial it is for them in terms of managing their symptoms. Secondly, I think it's important to investigate the mechanisms that may help us better understand the relationship between accessing urban blue and green infrastructure and then having a positive and beneficial experience and experiencing an improvement in symptoms. We know that pressure can play a role, but I think other possible mechanisms to explore could include more cognitive ones, such as a reduction in a repetitive negative thinking style common in depression and anxiety, known as rumination. And perhaps spending time in an environment that gently captures our attention, but also allows the brain to have a rest, encourages a possibly more positive state, such as reflection, rather than rumination. And finally, linked to this are questions around what physical aspects of urban blue and green infrastructure impact on any potential benefits, such as factors like quality and safety, but also any other elements that might be particularly important for encouraging that reflective state versus a ruminative one.